All right. Uh, so this is my joint construction assignment here. I've essentially created a hand. Um, half of it, half of it is mainly about the ligaments and muscles, and how they work. And I'm going to talk about uh, carpal tunnel syndrome and the treatment for that here. Um, and then on the other side here is the bone anatomy of the hand. Um, so divided by this tube here. So bone and muscles and ligaments. Because I split it up that way, uh, I'm not going to be able to discuss too much about some of the muscles here for the hand. I do have one specifically I want to talk about on this side, but just so I can get the best of both worlds, I did it this way. So I'll start listing things off, starting with the bones. I used little Q-tips here to show the distal phalanx, the middle phalanx, the proximal phalanx. Here is the head of the metacarpal. So each metacarpal has a head portion, so this curvy part that allows connection. Also, just for basis, just for the whole thing, all these yellow bits are to represent angular cartilage. So that's cartilage there that is needed to allow the bones and ligaments to bend smoothly, which it does. The whole hand is actually in scale to my hand. If you can see that, it is just my hand, really. If I can get the position perfect, yeah. So it's scaled to with my actual hand, and I made sure it is actually able to bend and flex just like a regular hand would. So on the back side, it's just cardboard, but on the top, it's the top view of the hand. As I'm able to demonstrate more of the bones easier, it's easier to identify which bone would be which. If instead of doing it this way, it'd be in reverse that way. And each finger does bend and joint without breaking, so I can bend that. I shouldn't have bent that one. That one is giving me a bit of trouble, but the rest of it is fine. I cut little pieces through the straw to make sure it can bend without breaking, which it does. And same from here, does the same thing. It's able to bend, and the whole hand is able to bend too, just like an actual hand, right? It's able to do all of that, so it's pretty good. Also, while I'm talking about how the joints are able to bend, I want to just take a look at one of my older projects. In one of my comments for other project, I listed off this. I told you about this hand here. This is a grade 5 project, and what I did, I used these strings to be able to bend the fingers. It's pretty old, but again, if I pull on this string here, it's able to bend the one. There's a little bit of a dent in the cardboard there, but I just wanted to demonstrate that it still has the same amount of articulation without the string. Back to this one though, continuing naming the bones, we have the trapezium. The trapezium is right here, goes for the thumb. Right here is the trapezoid. It's a little bit larger to scale, but still I wanted to identify them individually by sectioning them off with this black wire here. So this is just showing that these are separate bones, right? So trapezium, trapezoid. Then I have the scaphoid. So the scaphoid is right here. The scaphoid in the radius. So the radius is right here. I left this out because this is part of the muscle I wanted to talk about. This is the abductor pollicis longus, I believe. So that's why I cut out some of the white bone. But normally the radius and scaphoid would be connecting through here, but that's just where that muscle would be. Um, I Oh, and the metacarpal bones. Again, because I did it half and half, I did it on the one side. So here's a metacarpal bone, but each finger normally would have it. So here, here, and here. But again, just so I can get the best of both worlds, I did it half and half. And I really like that idea, how I did it like that. I think it worked out pretty well. So now I'll go into muscles, tendons of the hand. So transverse fibers of extensor expansions, so in other words, just the hoods, are these here. So these are the hoods here, around your knuckle, carpals at that point. So around here, the proximal phalanx would be in that area. They're a bit larger. Again, just to emphasize their presence, they essentially have the roomy shape here on the finger. And their main purpose is to shield it off, make it bigger. And again, right here, you can definitely see it. So again, it's a bit larger there. Again, it's the muscle that allows you to do part of this with help from other ligaments. And you can flex it and everything from the bottom side. And this is what allows you to do that. The dorsal and trapezius muscles, these ones go in between. So in the red spots here, so in between the middle finger and ring finger here, these are muscles in between the ligaments that allow you to kind of curve the hand like so, almost, when I curve inwards. And it also helps keep these in place and be able to function, which it will do. Again, it's all Play-Doh, and it does harden over time, so it's not as doable, but it is able to bend, as you can see there, and that's those muscles. And there's more on the other side too, just this is the bone side, so I didn't include it there, but they are there. Then there's the extensor digiti minimi, funky name, but that's the muscle right here. All that does, it helps bend this finger more here. So if I started from here, again, that would be allowing that bend to happen there. After that, I have the extensor digitorum. So down here, by the wrist, these here, I used little paper straws. There's one in between these two, and then there's the other one here. There's more. There would be more here, but again, bone and muscles, ligament side. So showing here what these do, these essentially hold it in place, and it allows more connections from the ulna and radius. So radius and ulna. That's the main point of that. It allows for that movement and for that to happen, right? And then the other one I wanted to talk about, I think I did mention it already, but just in case I didn't, I wanted to talk about the abductor pollicis longus. I believe I did, but that would be here. Again, it's why I have the radius and scaphoid separated. I believe in my digital photo with all this information, I put a piece of plasticine here, and then I submitted that, just so you know how that works. So right here on the digital photo, that's there, just so you are aware. Here, this is the area I wanted to talk about for the common injury. So essentially what happens, this piece here, this is the transverse carpal ligament. So essentially what happens is that this ligament ends up covering this area, which disallows for more movement. It's stiff. It causes lots of pain, and it doesn't allow for movements to go flex and extend that way. And it also affects these areas too, as it's the whole hand. Again, it disallows movement and articulation from here for the joints to be able to hinge. And yes, these are all hinge joints here for the finger. Not all of them are hinge joints. Sometimes they change, such as the metal carpals. I believe some of them have saddle joints when I was doing my research. So yeah, not to mix those up. And then essentially for the surgery for that surgery for carpal tunnel syndrome, the surgery is essentially taking this ligament here. I am able to take it on and off. They essentially split it in half almost, and they're able to release the trapped nerve. So essentially it traps the nerves, and by splitting it, they're allowing that nerve to be able to connect with the rest of the body, allowing the brain to send a message to this area to signify movement. And yeah, that's about it. So again, here's a before surgery. Disallows movement. It disallows movement, a lot of restrictions. Can't flex or extend with that. When it's split in half, it still has the ligament attached to make sure there's no further damage, and still allows some movement because it is needed for some movement, but just when it does this, this allows the actual nerve to function correctly. So by splitting it, it keeps the necessary structure but releases the nerve that connects all of here. Then also, I believe I already said this, but again, all the yellow spots are just areas of cartilage. And down here, ulna, radius, and the black lines here are just to separate the ligaments from the bones, muscles and ligaments from the bones. And yeah, I think it went pretty well. It's still able to move, just like a hand would be able to. Again, it's able to flex and do its thing. Yeah, and I enjoyed building it. I think it went really well. So, yeah. And the rest of it is online, assuming this video gets to you. Thanks a bunch.